Hey there, and welcome back to the Make Healthcare Great Again podcast. I'm Diane, and I have to say that this episode is not going to be easy to express, but I believe it's one of the most important messages I've ever shared. And it's something that we don't talk about enough in healthcare, and something that we have lost without even realizing it. And I hear it in the stories, and I hear it from people's experiences. What is it? We've stopped listening. And I believe, like deep in my bones, right to my soul, that this is costing lives. And not in metaphor, but in real, painful, and preventable ways. And so today I want to just unpack this a little bit, and I want to share a story, and I want to speak directly to the part of you that knows deep down that something has gone terribly wrong in our healthcare systems, and now you're feeling ready to remember how to make it right. So let's get into it. So here's the truth that no one wants to say out loud. People are dying. People are dying not because we don't have smart professionals or advanced technology or protocols or clinical guidelines. People are dying because we've forgotten how to listen. We're rushing, we're performing, we're documenting, we're surviving, and in the midst of all that noise, the busyness, the rushing, performing, documenting, surviving, just getting through your shift, getting through your day, is in the noise of all that mess, we're not hearing what matters most. So I worked in the Western medicine field as a nurse and then as a nurse practitioner for over 25 years, and I myself was in those situations. And there are many situations. For example, if I'm in the staff meeting room where people try to speak up and get shut down or dismissed or ignored, or patients who get brushed off because, they're just a frequent flyer. The truth is they're not being heard. And I've seen so many amazing, good-hearted nurses and doctors carry so much pressure and noise that they essentially stop trusting their own instinct, or they forget about their own instinct, or they don't even feel it. Their intuitive sense is lost because of the noise and the pressure. And so I have lived the pain of a system where we're constantly told to smile, be professional, stay quiet, and follow policy, even when our gut says something else. And I've seen the cost of this firsthand. So there was one moment that I'll never forget. A staff member raised a concern about a patient who wasn't doing well. It was a quiet and respectful concern that was raised, but very firm. She could really feel like something wasn't right, something was off. And she didn't have specific numbers, she didn't have any proof necessarily, but just a very strong gut instinct and the courage to say, something is not right here. And she got brushed off. And ultimately, people were looking at her like she was crazy, or saying, no, the vitals are stable, like, what's your big worry type of thing. Like, she got brushed off. And so the conversation moved on, and nobody followed up. And 2 days later, the patient died. And to this day, that intuitive sense, the gut feeling, the voice, the quiet warning, honestly, like, that was the most important part of what that was happening in the room. And because that person was dismissed and wasn't on shift for the next couple of days, all of that got lost and the patient died. And so here's the thing, like, nobody listened. And so this is a clinical situation where a nurse is not being listened to, you know? And it's like, you just realize how important listening is. And I remember that case scenario and more that just broke something inside of me, right? And it brought it to the surface over and over, because it wasn't really that, okay, there's just like a one-time thing or there's this single mistake that happened that could have cost somebody their life. It's not a single mistake. It's genuinely a culture problem. It is kind of like, this is the way we do business. This is how we treat people. This is the way we operate, like a culture problem. And so, in other words, at the root of it all, it was a listening problem, right? And so, when we stop listening, we lose far more than just what's happening or just what's going on in that particular moment. Because ultimately, we lose trust, whether it's in staff, coworkers, leaders, in our care. If we're patients, we lose trust in our care providers. We lose clarity, we lose safety, and eventually we lose people. You know, it's sad. Like, for example, we lose the patient who totally gives up on their health after being dismissed too many times. We lose the nurse who burnt out because her intuition or her insights or her gut feelings were never heard. We lose the connection between staff because nobody feels safe enough to speak honestly. And not only that, we lose the spark inside of ourselves, because that's the part of us that knows what care is supposed to feel like. We know what care is supposed to feel like. So this is the problem. The system wasn't designed for deep listening. The system was designed for documentation, policy, billing, compliance, right? That's all very cold stuff. That's not going to make for good care. So the real medicine comes from connection. And connection starts with listening. Listening is the foundation for all connection. So now, I'm not here necessarily to blame anyone, because we're all doing the best we can with what we've been given, right? It just is not working. So we have two choices. We can stay inside the system and keep doing what's always been done and on repeat, and then just keep losing pieces of ourselves along the way. Or we can begin to remember what we already know. We all know that listening just isn't some kind of soft touch. It's important. It's leadership. And it's what builds safety in a room and trust in a team. It also builds trust in care providers from a patient. So listening allows us to lead change from the inside out. So if you're listening to this and something in you is really stirring, like maybe your chest feels tight, maybe you're holding back tears, maybe you're just feeling like, oh my God, like I totally click with this message, then just listen to something. You're not being too sensitive. You're not overreacting. You're simply aware of the truth. You are awake. And you are the kind of leader that we need now in healthcare. Not just to follow another new policy, but to completely rebuild the foundation of healthcare itself. And so this starts by coming back to the absolute basics, not some kind of checklist or guideline, not the charts, not the policies, but to human truth. Human truth. And that is presence and connection. And to listening. Like truly listening to what's being said and what's not being said. And if you're a practitioner, if you're a leader, if you're somebody that works with clients and you work with patients, you work with people, you support others like on a team, truly listening is the real medicine. And you are able to carry this. You are able to be that. And so I'm inviting you to simply take a moment to pause and to reflect and to come back to your own self, to your own voice. And if you feel like this message was speaking directly to you, I'd love to hear what it stirred up inside of you. So whether you're working in the system or you're a patient or you're building some kind of new clinic or health service outside of the system, or you just have this feeling inside of you that you have this vision for something better, you just feel it and you don't know what to do to move it forward. Well, let's talk, because I offer private calls for rebel-spirited leaders, people who are interested in grassroots building, and those people that are sitting in their power, who are sitting quietly, who know the truth. It wants to come out, but you're hesitating, right? So I call that being a quiet lion. You're just ready to listen differently and to lead with truth. I invite you to go to my LinkedIn, or you can message me directly. I will put the links in to book a call with me as well. Definitely check that out. Here's the thing. We don't need more checklists. We need to have more courage. Our voice is important. We don't need another policy. We need people who remember what care actually feels like. And so I want to say again, you're not alone in this. You're not too much. That part of you that cares and really wants to listen to people, you are the medicine that the system forgot. You're the medicine that the system has not encouraged to work the way you're meant to work. So let's make healthcare great again by listening first. Listening at the foundation of everything to build that connection. So thank you for being here, and I will see you on the next video.